You're listening to Clara and Phone Radio 1. I hope you're well, and it's a beautiful sunny day wherever you're listening.
This is just the beginning. Get to know if you don't know what. Run up and you know what. Running from the you know what.
He's banged it in the top corner, yeah?
I don't even want to speak very long. This music's way too smooth. But how can sound waves physically make you move? And in return, you get experiences you like. It lifts you
Earth's starting to look pretty small now. I guess the world really does
Be moved by the power of BBC Sound.
Good morning, welcome to Breakfast with Naga Chetty and Charlie Stake.
Our headlines today. Some of the toughest new COVID restrictions in England are expected for 1.5 million people in Merseyside as the region responds to soaring infection rates.
A major study suggests growth of the pandemic may be slowing, but the government warns the country is at a critical moment.
Not only cases going up, but we're already seeing an increase in deaths. So things are definitely headed in the wrong direction.
Good morning. It's the final countdown for furloughed workers. There's 1 month left of the multi-billion-pound scheme, but more than 10% of the workforce still relies on it. Has it saved jobs? And what comes next?
A total ban on plastic straws, stirrers and cotton buds comes into force in England.
Good morning. Will Gareth Southgate give his misbehaving youngsters a second chance? Phil Foden and Mason Greenwood will find out today if they've made the England squad just a few weeks after being thrown out of the last one for breaking COVID-19 rules.
We meet the sniffer dogs being trained to detect whether someone has coronavirus in less than a second.
Good morning. Today's going to be drier and brighter than it was yesterday when we lose this morning's rain. But this is the calm before the storm. Tomorrow and the weekend looking very wet and very windy. I'll have all the details later in the programme.
Good morning. It's Thursday, the 1st of October. Our top story is that residents in another densely populated area of England have been told to expect tougher coronavirus restrictions.
MPs from Liverpool and its surrounding towns and boroughs, which have some of the highest numbers of positive COVID cases, were told about the imminent change last night. Anna O'Neill has this report.
Liverpool city centre last weekend after the pubs closed at 10. No masks, no social distancing and seemingly nowhere else to go. This is a city where COVID-19 cases are rising fast and which later today might be the next to see stricter lockdown measures. And many people in the city would welcome them.
I think it needs to happen because when all the students come back it has gone higher.
Yeah,
it has spiked, definitely. Nothing's really been done about it.
Closing pubs at early hours, don't really see the point in it, but I do think it's in the best interest to keep the public safe, yeah.
Local leaders are worried about the latest figures in Merseyside, and here's why. Of the 4 hotspots in the northwest, 3 of them are in Merseyside. Per 100,000 people in Knowsley, there are now 262 cases. In Liverpool, there are 258 cases per 100,000 people, and in St Helens, 212 cases per 100,000. At yesterday's Downing Street news conference, the Prime Minister Boris Johnson was explicit. Expect more local restrictions.
It may be that, again, this is a more localised phenomenon this time, in which case all the more reason for us to concentrate on these local solutions as well as the national solutions.
Almost a third of the UK is now in some form of local lockdown, and Merseyside isn't the only place facing tighter restrictions. From today in parts of North East England, 2 households are banned from mixing anywhere indoors, although support bubbles are exempt. Parts of North Wales will follow South Wales with stricter rules, including people being told not to leave their own area unless absolutely necessary. The government's chief medical officer said the UK would likely continue to see localised surges, while other areas have a relatively low rate of new cases.
But it's possible
that in this next stage of the epidemic here, we will have a pattern more like that, where it is more highly concentrated in certain areas, lower rates in the others. But it is far too early to say that. We've got a long winter ahead of us, and a lot could happen over that time.
But despite the rise in figures, early results from the largest COVID-19 study in England suggest the rate of infection, or R number, has fallen and the virus may be slowing down, which means protective measures taken locally and nationally may be working. Anna O'Neill, BBC News.
A large part of North Wales will go into local lockdown today, bringing it in the same restrictions as most of South Wales.
From 6 o'clock tonight, people will not be able to leave or enter the council boroughs of Conwy, Denbighshire, Flintshire and Wrexham unless they have a reasonable excuse such as work or education.
All NHS staff should be tested weekly for coronavirus as a matter of urgency, that's according to a group of MPs.
The Health and Social Care Committee says the government and NHS England must set up weekly testing before winter at the very latest. The Health Secretary, Matt Hancock, told MPs in late June that NHS staff could expect regular surveillance testing, but this hasn't yet happened.
Well, we know from the first wave of the pandemic that around 20% of staff got the virus in many hospitals, and up to 11% of patients who died of coronavirus actually caught it in their own hospital. So regular testing of staff is absolutely essential. The government has conceded that it is necessary to do it in the hotspots where the prevalence is rising, but it's not happening there either, and that's why we urgently need to address this.
Let's speak now to our political correspondent, Chris Mason in Westminster. Morning to you, Chris. So we had a press conference from Boris Johnson alongside his medics, his scientific advisor as well. The message was mainly about reiterating the problem we face right now, this critical point.
Yeah, that's right, Charlie. Good morning to you. I think there was a real sense yesterday from the Prime Minister and the scientists that, yes, if you saw some of that news conference, you might have think, haven't we heard all of this before? Well, the answer is yes, but the government is acutely conscious as we head into the autumn, as the cases start to tick up, as we all start to get, frankly, a little bit bored of the restrictions that we're having to live under and the prospect of it getting worse before it gets better, that we have to kind of knuckle down and put up with it and accept the fact that this virus isn't going anywhere soon and sort of adapt our lives around that, really. I think there's an awareness in government of the potential for complacency, coupled with, obviously, the vast economic costs of the limitations still being placed on the economy. What we're expecting pretty soon, as we were hearing just there, is announcements for the Liverpool City region. I know that MPs from the city met the Care Minister, Helen Whately, last night to be briefed on what is likely to happen. So pretty significant restrictions coming on Merseyside. There's also talk privately this morning of introducing a new tiered system, Charlie, to make it easier for us to understand in England, frankly, what on earth the rules are wherever it is that we live, potentially having 1, 2 and 3 tiers from the most severe at 1 to the least severe at 3, explaining how we have to live our lives. The aim being that we don't get as confused as Boris Johnson managed to the other day. Yeah, probably worth saying, Chris. We're going to speak to Joanna, who's the Mayor of Liverpool, just after 7 o'clock this morning, maybe get some more on those regional changes there. We are used to new laws a little bit at the moment, but there is one that is now going to be coming through to do with plastic straws and stirrers. Tell us more about that. Yeah, that's right. This is a law kicking in today in England, meaning these things become illegal. Plastic straws, they've, well, never been far from our lives, have they? For years and years, the government wants rid of them. It announced the ban some time ago. The whole thing was postponed because of the coronavirus. The idea is that they are dreadful, frankly, for the environment, particularly when they get into our waterways. So they are going. There are currently lorry loads of these things produced every year. They will go replaced with paper straws. So if you manage to find any plastic straws kicking around at home, as I did this morning, make the most of them, because there's soon to be a goner. Chris, thanks very much.
I have never felt as nervous and as scared about anything in my life.
Here we go! No! What a weapon! Fire! Don't tell me not to worry!
going to go and give myself a quick wet wipe. I hope they've been in the fridge.
Brand new Top Gear starts Sunday at 8 on BBC One and iPlayer.
It is 17 minutes to 7. Good morning to you. Dogs, they've helped millions of us get through the pandemic, cheering us up, keeping us company, giving us a reason to go outside and exercise.
Now it seems they might also help us to defeat the virus itself by using their incredible power of smell. Breakfast's Graham Satchell has this report.
This is Asher. He's a medical detection dog. Scientists are hoping specially trained dogs like Asher could be a vital help in the fight against COVID-19.
The dogs have this incredible sense of smell. They have 350 million sensory receptors dedicated to olfaction. Now, us poor humans have got 5 million, and we think we can smell pretty well.
Asher's remarkable nose has already been trained to sniff out a number of human diseases like cancer and malaria. Now, a joint research project with the London School of Hygiene and Tropical Medicine and Durham University is seeing whether they can detect COVID-19.
We now know scientifically that diseases change body odour. And, you know, dogs are incredibly good at sniffing, and we all know that, but they're also very good at learning as well. And so they can learn the smell of a particular medical condition. We now know that dogs really can do this really well, so we're really hopeful that the dogs will be able to do this with COVID-19.
Helsinki Airport in Finland. Trials have already started here with dogs sniffing passengers as they arrive.
So these dogs are able to do a rapid, non-invasive test as whether someone is carrying the COVID-19 odour, and that's whether they're symptomatic, whether it's pre-symptoms. And this, of course, could be a game changer. So whenever you get a public space where people are moving rapidly, the dog, in a 0.5 of a second sniff, will be able to say, you've got the odour of this virus, you need to get tested and isolate.
This is Kip, one of the dogs being trained to detect COVID-19. He lives with Sam.
I think it is a fantastic project. The capability of dogs to do mass screening in a speedy time is really, really important because COVID's going to be with us for a while yet, so they have a massive part to play.
The dogs are trained by sniffing samples of clothing from people who currently have COVID-19. Researchers say they desperately need more samples and are appealing for help.
Good girl. And particularly we need people who are positive, who've had a recent test. And what we'll do is basically send a pack. It's really, really simple. So we have 3 items, one being a pair of stockings, a face mask, and a shirt or a t-shirt. And basically we're asking people to wear those for a few hours, pop them back in an envelope that's prepaid and send it back to us. But we need as many people as possible, particularly those who are positive.
Once the research project is complete, scientists say these dogs could be sniffing out the virus in public places in a matter of weeks. Graham Satchell, BBC News.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.